Thank you, Mr. Chairman. So last November, while you were under consideration to become Secretary of Health and Human Services, Mr. Kennedy, you said, quote, if vaccines are working for somebody, I'm not going to take them away. No exceptions, no ifs, ands, or buts. You would not take away vaccines from anyone who wanted them. Then last week, you announced that the COVID-19 vaccine is no longer approved for healthy people under the age of 65. In announcing the change, you said the vaccine will be available for anyone who wants it. Now, obviously, both things cannot be true at the same moment. So let's clear this up right now, Secretary Kennedy. Will you tell America that all adults and all children over 6 months of age are eligible to get a COVID booster at their local pharmacy today?
Anybody can get the booster.
I'm sorry?
Anybody can get it, Senator.
Anybody. So you're saying that is now the official rule of HHS. Anybody is eligible to get a booster by just walking into the pharmacy.
It's not recommended for healthy people.
No. If you don't recommend, then the consequence of that in many states is that you can't walk into a pharmacy and get one. It means insurance companies don't have to cover the $200 or so cost. As Senator Dr. Cassidy said, you are effectively denying people vaccines.
We're not going to recommend a product for which there's no clinical data for that indication. Is that what I should be doing?
What you should be doing is honoring your promise that you made when you were looking to get confirmed in this job.
You're going like this.
And that is, you promised that you would not take away vaccines from anyone who wanted them. You just changed the classification of the COVID vaccine.
I'm not taking them away from people, Senator.
It takes it away if you can't get it from your pharmacist.
Well, most Americans are going to be able to get it from their pharmacy for free. Most Americans will be able to get it from their pharmacy for free.
The question is everyone who wants it. That was your promise.
I never promised that I was going to recommend products for which there is no indication.
When you said...
And I know you've taken $855,000 from pharmaceutical companies, Senator.
Did you hold up a big sign saying that you were lying when you said that? Because you are the one who said you would not take them away.
You can still get the COVID vaccines, and Medicare will still pay for them, and Medicaid will still pay for them.
Tell the head of the CDC that if she refused to sign off on your changes to the childhood vaccine schedule, that she had to resign?
No, I told her that she had to resign because I asked her, are you a trustworthy person? And she said no. So if you had an employee who told you they weren't trustworthy, would you ask them to resign, Senator?
So I'm sorry, but this is not what she has said publicly. She has said
I'm not surprised about that.
So you're saying she's lying?
Yes. Every conversation I had with her, there were witnesses.
Let me get this straight. This is the same person that less than a month earlier, you stood next to her and described her as unimpeachable. And you had full confidence in her, and that you had full confidence in her scientific credentials. And in a month, she became a liar?
Yeah, you should ask her what changed. And by the way, a month ago, you were voting against her. Oh, because you thought she was either incompetent, ineligible, or unsuited to the task.
I voted against her because I was afraid she was going to bend the knee to you and Donald Trump. And it looks like she didn't bend the knee, so you fired her. Look, you're putting America's babies' health at risk, America's seniors' health at risk, all Americans' health at risk, and you should resign.
Senator Sanders.
I can't conclude from the discussion today where you are on warp speed. So I would like the definitive statement on exactly where you are. Was it good? Was it bad? Were there things that worked? Were there things that didn't work? I can't discern that from what you said here. I, for one, think that it was a signature accomplishment of President Trump, and the mRNA platform is something.
I agree with that.
I look forward to you giving us a detailed statement on exactly where you are with warp speed. But I do also believe that some of your statements seem to contradict what you said in the prior hearing. You said you're going to empower the scientists at HHS to do their job. I'd just like to see evidence where you've done that, and I'm sure that you will have some. You will do nothing that makes it difficult or discourages people from taking vaccines. There seem to be several reports that would seem to refute that, but I'd rather you just respond to it. I'm not going to come here and impose my belief over any of yours. That, again, seems to be contradictory to the firing of a CDC director, the canceling of mRNA research contracts, firing advisory board members, attempting to stall NIH funding, eliminating funding for the I think $500 million for further mRNA research, and just want an answer for it.
You're recognized.
Thank you, Mr. Chair. Let me ask you, when were you lying, sir? When you told this committee that you were not anti-vax, or when you told Americans that there's no safe and effective vaccine?
Both things are true.
Oh, so more denial, more back and forth. I mean, here's what I know. Here's what I
Want me
know.
to explain why, Senator? You just
No,
want
actually, I want you to listen to me.
Okay, go ahead.
I want you to listen to me, because I've been listening to you. You said that ACIP is an independent panel after you stocked it with your picks. You said that you want evidence-based science, but it seems that what you mean is evidence that supports your view, not the scientific consensus. I mean, you dared to sit there and call my colleague from New Hampshire a liar when she presented you with facts that don't support your view of the world.
I think that we all have a history of listening to you and these answers, but you're on the record for a number of these statements. Despite your lack of credentials and expertise, clearly you have an agenda. It is a threat to the public health of the American people. It's clear that you are carrying out your extremist beliefs, which is why you attempted to fire Dr.
Senator, we're the
Menarez.
sickest people in the world. We're the sickest people on earth.
I'm speaking.
How am I a threat?
Secretary Kennedy, for the first time, we're seeing deaths from children from measles. We haven't seen that in 2 decades. We're seeing that under your watch. You are a hazard to the health of the American people.
Can I respond to that, Senator?
No, I claim back my time.
We need to wrap up.
You are a hazard to the health of the American people. I think that you ought to resign. And if you don't resign, the President of the United States, who put forward Operation Warp Speed, which worked, should fire you. Thank you so much.
Senator Welch.
If you like this video, then like, share and subscribe to Mirror Now.